My name is Marjorie Lee White, and I'm a pediatric emergency medicine physician in practice and a pediatric simulation by passion. And I am very fortunate to have had a role at the American Academy of Pediatrics as a member and as a leader within the section on simulation and innovative learning. And in that position, I have the opportunity to collaborate with both members of the American Academy of Pediatrics and also with the staff who have had an incredible partnership with Laerdal in making sure that we're making advances and really highlighting pediatric simulation. I think that there have been some really remarkable connections with the American Academy of Pediatrics and Laerdal really over the last 30 years. And so some of the exciting things that have come out of that partnership are really improvements in all of the technology and also in the delivery systems and the way we're able to together really get all around the world with the expertise with the Laerdal company, and then also with the networking and the really relationships that the American Academy of Pediatrics has with its partners around the world. It is an incredibly exciting time for healthcare simulation and really particularly for pediatric simulation. We have the opportunity to take advantage of so many technological advances, including artificial intelligence, including the virtual platforms and the way of thinking about that. And I think it really comes down to remembering that simulation allows us to put our patients first. And the most vulnerable of all of our patients are our kids and our newborns, and that we're able to take advantage of the changes and in technology, but bring it back to what's most important, our patients. To me, one of the really exciting things that's come out of the American Academy of Pediatrics and the Laerdal partnerships are the ways that we're able to connect members of the section on simulation and innovative learning to the technology and to make improvements and to make sure that what we're being able to deploy in all of our different settings around the country and even around the world is both either at the highest level, but also has the fidelity that we really need so that pediatricians recognize what the tools and tactics that they have available to them. And I think really the sky's the limit for innovative learning. We have so many opportunities, and that's what's really exciting, and that's what keeps me in the pediatric simulation world. Pediatric simulation is incredibly important because it's at the essence of what we really need to do in simulation. So the most vulnerable among us are newborns in low resource settings, our newborns in high resource settings are the ones that we shouldn't be practicing on. And simulation puts them first. It allows us to fulfill our patient safety mission so that we can tell parents, we've practiced, we know how to do this, we just didn't know your name. We didn't know your child's name, but we knew that this was going to happen, and we're ready to take care of your child. The SimNewbie partnership is incredibly important because it brought in folks who are both providing care in various settings, and it also brought in simulationists and allowed for the opportunity to have just the perfect setting for innovation, for ideas, for iteratively improving the process. And that's what we want and need, as educators, as clinicians. We want the product that makes sense from a business sense, but also from an educational and real world sense. And so the AAP and Laerdal collaboration is incredibly important for that. One of the ways I see simulation-based education evolving is really thinking about it, both individualization and kind of systemization. That's the way I think of it. So we have so many different folks who provide care in so many different settings. And I think both from an individual level, from a team level, and from our system level, we've got to figure out how to get different types of sim to different people in different places in a way that it works for them. So it may be that we need just-in-time options for simulation. We may need just-in-place options. We'll need virtual options. We'll need all different options. So I really think of it as a menu that'll be continually expanding, as well as, systems of care getting feedback about what all of the different individuals and teams, where they are and where their gaps are, and how do we help close those gaps. I think that's the only way we're going to really change the care that we provide and help us impact all of pediatric care.